Good morning. You're listening to Retake Our Democracy, a 30-minute weekly show that airs at 8:30 a.m. every Saturday morning at 8:30 on KSFR 101.1 FM, your Santa Fe public radio station. And we are now in our 5th year of broadcasting. I'm Paul Gibson, the host of Retake Our Democracy. And today I'll be speaking with Mary Feldblum, the director of the Health Security for New Mexicans campaign. And we'll be discussing the next rendition of the Health Security Act, HB 203. And that's the Health Security Plan and Design. And last week we spoke with Angela Merkert. She's the executive director of the Alliance for Local Economic Prosperity, the organization that is coordinating the development of the bill to create a state public bank. And the week prior to that, in our continuing coverage of bills that Retake is supporting as transformational bills, we spoke with Marielle Nanasi, director of the New Energy Economy, who is pushing for both revisions to the Energy Transition Act and for passage of local choice energy. So we'll get to our discussion with Mary in just a second. Because the session is upon us and rapidly progressing, we will make all of these interviews immediately available even before they appear on KSFR. So our conversation, for instance, with Mary Feldblum will be posted on February 12th. And if you're driving around today and don't catch all of today's show, you can watch it, by going to retakeourdemocracy.org and hovering over the actions page and clicking on Retake Conversations, and you will find it there. Let's see what's next. Oh, we'll get to our conversation in a second, but I do want to acknowledge that we are conducting this interview on stolen land, stolen Tewa land, and we want to thank our Tewa neighbors for being such good stewards and hosts of that land. And then I want to remind you that Retake Our Democracy has a 2021 legislative strategy and 20 transformational bills and 28 priority bills for which we're advocating. And we started that advocacy work the day after the general election. So just go to retakeourdemocracy.org, click on New Mexico legislation in the homepage menu bar, and it will take you to a page with information on our bills and also an array of resources to make your advocacy easier and more effective. If you're interested in more information on this work, just write to us at retakeresponse@gmail.com and this is even better, join us for our Friday afternoon Zoom strategy huddles. They're every Friday from 3:30 to 4:30. The sessions are really important opportunities for you to learn how the legislature really works and where the levers of power are and how your legislator is doing. You can find an invite to those sessions at our homepage. All you have to do is click on the Actions and Events menu, and right near the top of the page that you open will be the link to the weekly conversations huddles. So let's get started with Mary. Welcome, Mary. Haven't seen you for a while.
It's a wonderful opportunity to be with you once again, Paul.
Yeah, I miss sitting next to you in the roundhouse, but I must admit I don't mind doing the sessions on some level in sweats, and it is a little bit more comfortable and certainly more accessible for people who live far away. I think that's one thing we've definitely learned. So I always like to let our guests introduce themselves. So if you could just tell us a bit about yourself and your career, basically advocating for the Health Security Act in New Mexico. How about if you, I had a funny thought, at the Women's March, there were women marching that were saying, I can't believe I'm still carrying this sign. And I'm imagining you can't believe you're still trying to get this bill through, but maybe this is the year. So tell us a little bit about yourself.
Well, I'm an academic, a PhD in sociology and economics, and was an academic for many years before moving out to New Mexico. And then I became involved in lobbying for environmental causes. And what was fascinating for me, here I am a social scientist, understanding the causes of social problems, looking at solutions, and I didn't know one thing about lobbying. And it has educated me over the 30 years that I've been doing it about insider outsider strategies. One of my specialties as a social scientist with social movements and looking at the success of social movements and the failures of social movements. And when you think about it, big changes take time. Civil rights, child labor, labor laws. The Wagner Act was passed in the 1930s. There were unions prior to that they were killed right and left by the Peabody and the military. So it's a long struggle, and women's suffrage is another one. And so it's not, I'm not surprised, because we are challenging a basic tenet of capitalism, that the private market can solve healthcare, and it hasn't. And what we're saying is that we need to set up something that is not a system that's in the for-profit market model that guarantees health security. And that is a major challenge. And so it's been very exciting for us to gain enormous support over the years, and to also now come to this point where we have a chance of being the first state to actually rolling up our sleeves and setting up something that's very different.
Yeah. What's the province in Canada that was the one that got
Oh, Saskatchewan was the
Saskatchewan?
poorest province, and they were the first one to do it in Canada.
And so we're going to follow in their footsteps. So can you start by telling us just a little bit about HB 203, what it would do, and a bit about how it differs from other renditions from the past?
Well, the Health Security Act that we have been educating people about is a 75-page bill that really specifies who would be covered, what the coverage assumptions are, how physicians would be paid, global budgets for hospitals. And it's received so much wonderful input from around the state over the years. It's a very innovative bill, but it doesn't, there are questions that are not answered. For instance, how much are doctors going to be paid? How are global budgets, which are operating budgets for hospitals, so you don't have charges anymore, they have it's an incredible system. How will that work? How much can we assume will those budgets cost a plan? And how will bulk purchasing of drugs work? Different European countries do it in different ways. And how
Right.
will it? So we need to roll up our sleeves and figure that out. And Representative Armstrong is really felt that we needed to figure out a design process. So it's the Health Security Act. I often describe to people as a great recipe, and now we're the cooks. And we're
Right.
going to look at the ingredients. Maybe we have to add a little bit more of this, do a little bit of that. But there has to be a public process with the cooks so
Right.
that we design something. And that's what the Health Security Planning and Design Board does. It's a publicly accountable entity that will first consist of experts. They have no legislative authority. It's like a task force. And they will have consultants, consulting money. They will have advisory committees, so that they'll be asking nurses, acupuncturists, primary care doctors, hospitals about decisions that how this plan is really going to work. It's one thing to have it to sort of say, we're going to have these great things, but now we've got the challenge of figuring out the details so that by the time we all get our cards and go to the doctor of our choice, that physician is paid in a timely fashion.
So will you have something to go to the legislature in 2022 to authorize, the next phase?
Well, it's estimated, and we've always talked about a go slow approach. This is major.
Right.
And there are a lot of big decisions. I mean, just figuring out, for instance, the topic of not just what physicians, providers should be paid, but how. What's the methodology? which is a nightmare right now. And
Right.
we have a chance of designing something that is much better. Switzerland, for example, pays physicians by the hour. Totally different system.
Right.
Uh, and we have an opportunity to design something that is much more, much easier to deal with, more accountable, and it's connected to an IT system that drives physicians crazy, providers crazy,
Right.
and is really oriented towards billing
Right.
more than quality of care and real accountability. So we have an just dealing with that subject, can you imagine in 6, 7 months is a
Right.
big topic. The other one is how we're going to deal with bulk purchasing of drugs. It's a fascinating, when you start reading what Germany does, what France does, what Canada does, and we're a state within the United States, subject to different kinds of laws than a national government is. And so how are we going to work it? And how are 2 million people when can we assure that this plan will not only have a bulk purchasing drug program for the plan members, but that it will benefit all New Mexicans, even if they're not in the plan.
Okay.
So those are challenges that have to be thought through carefully. We're going to need a lot of creative thinking, a lot of creative people to figure this out. But these are not easy decisions to make. So it's going to take about 4 years. Originally, when we had discussions with Representative Armstrong and Senator Ortiz-Pino, and we've always thought it would take about 4 years. And the study, by the way, the recent study assumed 2024 as a starting date. That that the idea is you start off with, and this was their idea, with a group of experts, people who are, and the bill defines what experts mean, and let them start playing around with public input, with advisory committees, with consultants, design ideas, and bring that to the legislature. Has to be involved. And people have to think that almost half New Mexicans are on Medicaid. It's the legislature, the budget that helps pay for that. Then
Right.
there's state employees and retirees and teachers. So the big chunk of the state budget is already going towards healthcare. They
Right.
have to have a say in this. And
Right.
that's really important that they be included because it's a major change. And so they will get a final report. The bill says that, and they will have to figure out what the next step is. And of course, for us, the next step is setting up the Health Security Commission, which is responsible for administering the plan and will finish the job of design. Because when you think about it, our chair, Max Bartlett, describes this design board as like the architect. And then think of the commission, our citizens board, geographically representative, like a co-op, are the builders. They're the ones that are going to administer this. And just the way a builder may say to an architect, "Hey, the wall's going to fall down if you do that." They are the ones that are going to have to practically administer this, and they will have legislative authority to promulgate rules. So they will have legal authority, unlike this design board.
Okay.
And that will take, we figure, about 2 years to really come up with. And if they do it sooner, that's great. And there are things that are happening in the legislature here and now that will help expedite that.
Okay, that's great. That's really great. Given what you just said, it's hard to believe that we are hearing, and we spoke about this before we got started, from some legislators that, quote, "We really need to have a better understanding of the actual costs before we proceed." Isn't that sort of the whole point of the plan and design process? I think you
Right.
sort of answered that, but to
We
underscore.
have, that's the insurance industry will attack the studies to begin with, but we've had 3 studies now. And all 3, and I'm a social scientist, and I've looked at, ever since the early 90s, I've been looking at all the studies that have been done, whether it was the Congressional Budget Office or Minnesota or Kansas or Georgia. There have been state studies all across the board. And And they all have to make assumptions. They don't know exactly how much doctors will be paid, right? So they're going to have to make an assumption. They don't know if they have a global budgeting provision in some states don't. We do, where a hospital will have a guaranteed budget. We don't know how much that is, right? And particularly when the KNG report did its analysis, they were assuming 2024, they didn't even know who would be president. And that would definitely impact, as we know,
Right.
costs. And so you have to do something which is the real cost at some point, and when the plan is designed. So for instance, we have to figure out who's going to be included in this plan. The Health Security Act excludes the military retirees. That makes a lot of sense. So those numbers you can, easily subtract. But we also are saying that those that are self-insured and ERISA companies can voluntarily join. Well, how many will join? You may have to make some kind of projection and assumption, so you know how many bodies are in the plan. So who's covered. The coverage itself, we have a very good idea because it's a state employee services. We know how it's going to be administered. But there's all kinds of actual, the plan, it needs to be costed out as it is. And then how it's going to be paid for. And it's wonderful that Biden is going to be president, because he's talking about beefing up monies to the states for the Affordable Care Act. And that will be more federal dollars you can pour in to New Mexico, the less you have to generate in state to cover people.
Okay. Oh, you caught me. You're done early. I was cleaning my glasses. Bad radio.
But
Okay, so I just,
yeah, it's really important that this design process is really critical. And our campaign will really want to work on, we've been educating people about the need for this plan. Now we're going to have to educate people to get involved in the decisions about how this plan is going to work for everybody. And
yeah.
that's rural New Mexico. It includes patients, it includes doctors, nurses, acupuncturists, hospitals, and it's going to take time to make these decisions. These are not easy ones, and we'd be the first state, just like Saskatchewan, to actually come to grips with this.
So I need to remind our listeners that it is at times like these that KSFR is more important than ever, offering timely news and alerts and a wide range of programming to keep you sane while you're holed up at home. So for those of you who can afford it, please consider making a contribution and think of it as your ticket to admission to a wealth of good programming. Just go to ksfr.org and click on the donate button. And send them 10 or 20 bucks or $100 if you can afford it. Okay, today I'm speaking with Mary Feldblum, Director of Health Security for New Mexicans Campaign, and we're talking about HB 203, the Health Security Plan and Design Act. And even with all the studies, each of those different possible scenarios were projections. You were just mentioning this, and now the next phase is going to be to get to actual costs. So we're actually, another way to look at it is we're going from a conceptual model to estimating what implementation of a New Mexico version of the Health Security Act would actually cost. And you really sort of covered that, but I develop a set of questions, and sometimes our guests are a little eager and they cover it. So we'll move on. And I had one retake supporter comment on one of our posts that we had studied and studied. Why are we doing this again? And again, I think you explained that very well. So what are some of the concerns that you're hearing from legislators and others, and how are you responding to them?
Well, there's one legislator down south that has said this, Micaela Cadena from Doña Ana County, that she thinks that we have to deal with the here and now. We have to deal with the uninsured, and she's positing making the health security plan seem like it's an either or situation when it's not.
Okay.
We have always been aware that it would take time to create this plan. It's a major, major paradigm shift. We have to do it carefully. And in the meantime, we don't want the ship to sink. And
Right.
so there are all kinds of things. Representative Armstrong has a bill that's imposing a tax that the feds had, and she's reimposing it so the state can take it, and she's creating an affordable healthcare fund that will be used to help people who can't afford to buy insurance on the exchange, to purchase it, and will also cover copays and deductibles, which we know are humongous for people, and which even if you have insurance, you may not use it. And so so that's an option. There's also Senator Ortiz Pino is introducing a very exciting bill called Global Budgets for Hospitals. We know, and the pandemic has just
Right.
aggravated the situation.
Right.
And so what's exciting is European countries and Canada, they've been doing this budgeting system for hospitals, for many, many years. And in the United States, Maryland and Pennsylvania have started it, and there's federal dollars available for it. They get huge amounts of federal grants over time. And so Senator Ortiz Pino is saying, let's do that. Let's get the hospitals, the rural hospitals, advocates, et cetera, together and come up with ideas about how global budgets would work in New Mexico, because we're not Maryland, and apply for that grant and start the process now. There's the Interagency Pharmaceutical Purchasing Council that was created by Senator Steinborn, that is looking at agencies collectively purchasing for drugs using their clout, but also figuring out how that could be done for the whole state. And that's very, very exciting. And then the Department of Health is dealing with an IT system, trying an all payer claim system. So beginning the process of collecting the data you need, despite some resistance on the insurance industry, because they don't like their proprietary information they don't
Right.
want to give, but that would not be a problem. But all these efforts are truly important. The Department of Health is expanding its coverage of Medicaid. Half the uninsured are eligible for Medicaid and Medicaid expansion. And why aren't we taking advantage of that? And fortunately, we've got a president who wants to beef up those monies.
Right. Well, and it sounds to me like you were saying that some legislators see it as either or. It seems like the initiatives and bills you were just describing are all, especially the global hospital budget, are all like pieces to the health security plan that can be sort of operationalized, and that would better inform the whole design process, because you'll have actual numbers and you'll see how the global budgets work. So, and the same with the using the tax on plans that was introduced and is going to go for people who can't afford their health care. All of those could be pieces of the health security plan. So it's really hopefully just a matter, because Cadena is hardly a moderate. She's a great legislator, and I've got to think that conversations with people like that, they're not gonna they'll walk away convinced. I'm certainly hopeful. Have you had communications with her about this?
I think some of her constituents are. I think because she has been not supportive of. She's announced that, said she can't support health security, and I think the Doñana people will deal
Right.
with, but it's not only an either or. When you start talking about, and it's so important that people get insurance, there's no question. But there are two pieces to healthcare reform, and that is controlling rising healthcare costs. Otherwise, we are just more and more taxpayer dollars are going into a system where costs are going up and up and up. So that's why you need systemic reform. You need a system that is integrating things and will actually control rising healthcare costs. And that's what's so important about those 3 studies that have been done in New Mexico with different assumptions. They
Right.
all come to the conclusion that if we do some old-fashioned health risk pool, young, put as many people as we can in one health plan for New Mexico, we're going to see rising healthcare costs reduced. And it will be reduced for a whole, one is the administrative savings. And it's one of the reasons the insurance industry doesn't like this, right? Because we're saying you can offer supplemental, you can under Medicare, but you can't compete with this plan. We're self-insuring. It's going to save administrative costs. It's going to save administrative costs for hospitals and doctors that don't have to deal with hundreds of different plans, different copays, different deductibles. It's going to do bulk purchasing of drugs. It's going to do global budgets, which also reduces costs. And there are all kinds of reasons why this plan saves money. And the KNG study pulls that out. We have a key takeaway flyer on our website that gives you all the benefits of a plan like this and why it saves money. And so why not invest in it? And it's a small investment because we're not paying for the plan yet, right? It's a small investment of design.
One thing that occurred to me, because I heard, I was listening to the abortion ban repeal discussion, and a lot of the rural doctors, rural senators and reps were saying that, if you pass this, some of our rural doctors who are fundamentalists will leave the state. And I'm sitting here as I'm listening to you and thinking about, I worked in the health care system in California before we moved here. And the amount of effort, level of effort involved in your billing process is just ridiculous. And doctors just hate it. And so I could imagine a marketing campaign at, targeting med students to do their residency and move to New Mexico. You won't have to spend your time, with a spreadsheet calculating your billing, and really start bringing in some young doctors. What do you think? Is that something you're anticipating?
Oh, yes, we think it, but what we take the step back in terms of the design process. Imagine asking doctors and nurses and acupuncturists and chiropractors, how are we going to design your payment system and IT system? You're going to be involved in it.
Oh my, yeah.
In making that decision so that it's something unique and doable. And we may have to ease our way into something new and exciting, but they're going to be involved in that decision-making process, which is very exciting because physicians and others are not involved they've lost control over healthcare and to the dynamics of the market and insurance companies, Medicaid and Medicare.
So that's really fantastic. And, we've been doing a lot of research on worker-owned cooperatives and how much more invested the workers feel when they're involved basically in the plan and design. And that's what you're doing here. And I think that the medical profession is going to be really responsive to the way you've laid this out.
We have a beautiful state, and it's going to save money for our state government, which is spending more and more on healthcare. And if that can be reduced, then it can invest more in education, in jobs, in the environment, which something is very important to me personally. It creates it makes our state more attractive than ever because we have a beautiful state.
Yeah, we sure do. Well, we're out of time, Mary. I'd like you to give our listeners information about how they can get involved, how they can find out more information, etc.
Well, first of all, I want your listeners to know that the first hearing for the bill is on Monday at 8:30 in the Health and Human Services Committee, and they do a poll. Once the bill is presented, they do a poll, and we want as many people, even if you're not testifying, to listen in and say yes on the poll. That is really—
Put that in our alert. It's going out this morning, later this morning.
Great. And then the other thing is we have a website, www.nmhealthsecurity.org. You can get lots of information. You can sign up for our email system, and we give you a blow-by-blow report about what's happening during this session. And but we're very excited about this first step. And it will go to the it's the Health and Human Services Committee. And it had a $600,000 appropriation in it, which the LF Legislative Council economists estimated would be the cost of for the board, for their meetings, for their consultants and all that stuff. And believe me, that's $600,000 out of a potential $9 or $10 billion plan. I think Wall Street would say that's a good investment given the 3 studies.
Okay, well, thank you very much for joining us today, Mary. And I will certainly be listening and offering public comment on the health security design and plan and design. And thank you so much for your tenacity. They're going to have to erect a statue at the Roundhouse for you. All right. Thank you, Mary, and have a good
Thank you
weekend.
very, very much, Paul.
Okay. Bye-bye.
Bye.